Yeah, it was interesting. I was on a webinar where they asked, who should lead, who should be the executive lead of the data governance program. And and when people answered, the most, so the CIO was like 20%, the CMO was like 18%, CFO was only 2%, COO was like 20%, and other was 20%. So it was interesting that there wasn't a consensus on who should really own it. And so do you see across different health systems that different people own the data governance? Uh,
Yeah, I've been disappointed to see a lack of C-suite or executive sponsorship for it. I can tell, at least so far, it feels a little bit like a hot potato, and they know it's important, but they also know that it's kind of in its early stages. It's almost like an early IPO, and they want to be a part of it, but don't necessarily want their name attached to it. But I think you gotta identify somebody who really A, understands it, and B, recognizes how it's going to benefit the organization, who can really champion the effort.
yeah,
You know,
and it's
it,
it's and it's a leadership role, right? So you are influencing, you're changing the culture around data across your entire organization. So it requires a special person, and it's not something that you can just throw over the fence. I see a lot of health systems now hiring chief data officers and saying, okay, we're going to give it to this person. Well, okay, that's fine, but don't hire somebody that's just really good with data. You have to hire a leader who can who's respected across the board, who can interact really well with the leadership, and move the culture forward with education and other things.